We have with us Dr. Jasmine Surve ma'am. She is MD Gynecology. She has completed it from Sion Hospital, Mumbai. She is a practicing gynecologist and obstetrician in Thane district for past 22 years. And she has been associated with Queenscare Hospital since inception.
Good afternoon, Anam. Thank you for the nice introduction. Yes.
Okay. So ma'am, today we are here to discuss about the various trimesters of pregnancy. So can you just brief us about the same?
Yeah, sure. See, 9 months of the pregnancy is a beautiful journey. And these 9 months are divided into the 3 parts. We have a first trimester, second trimester and a third trimester. First trimester is from the first week till the end of the 12th week of the pregnancy. During this period, see, the conception has happened, implantation has happened. Initially, we'll have the development like a gestational sac, yolk sac, fetal pole developing, the cardiac activity coming up. Thereafter, we'll see the fetus getting into the shape, limb buds forming, from the neural tube, brain and the spinal cord forming, kidneys coming up. So this is the physiological development happening during the first trimester of the pregnancy. Coming to the second trimester, whatever development has occurred during the first trimester, it will go to another level. It's a beautiful transformation from a fleshy mass to a structure. Here we will have the fetus having a musculoskeletal development, heart, kidney, brain, liver, intestines forming. The placenta is maturing in second trimester because during first trimester the fetus is completely dependent for the hormonal supply on the mother's ovaries. Here it's like a fetus getting independent and forming own hormones. Coming to the third trimester, which is from 26th week till the term. Here mainly the growth of the fetus is happening. The fetus is gaining a length, size, shape. Placenta is maturing. During this phase, it's a beautiful thing. You can notice on sonography fetus kicking, smiling, yawning, eyeballs moving. So it's altogether a beautiful physiological, spontaneous, natural changes happening in the fetus, right from a cell to a fetus.
Okay, so that was indeed very beautifully explained by you. So now we will proceed with the commonly encountered questions by the patients in our OPDs and IPDs as well. So let's begin with that. So the first question is how to deal with the nausea and vomiting during the first trimester of pregnancy.
Oh, it's such a common thing. Actually, dealing with the nausea, which otherwise pregnant lady is going to experience in the morning, but the preparation to deal with it is going to start from a day prior. Like a night, what was her bedtime? What did she have for the dinner? How late, how early it was? It was a heavy or a light? Had she eaten outside? These all factors are going to affect her morning sickness. So she has to keep these factors under control. Morning after waking up, it's better to avoid the liquids in initial 2 hours of waking up. She can have a bread jam, toast, a biscuit or the resins. After 2 hours, she can go with a regular breakfast. And in certain cases, antacids and the antiemetics are required to deal with it.
So basically what you say is along with the lifestyle modification and supportive medications, we can deal with the nausea and vomiting.
Yes, yes.
COVID. Is it necessary for a pregnant lady to take COVID vaccination?
Oh, pandemic. WHO and Indian government both have suggested pregnant women to take full COVID vaccination. There is no controversy on it.
Okay. So now the next question would be, coming to the diagnostic part, how many USGs are required during the entire duration of pregnancy of 9 months?
USGs play a very important role in managing the pregnancy period. It will depend the easy accessibility to the sonography. Like now we are sitting in the Mumbai city. If a lady is in the interior of the India or in the village area where the sonography is not available, then the situation is different. But wherever the sonography is easily available, first sonography sonography will usually be recommended by 2 months, just to know it's a singleton pregnancy, twin pregnancy, what is the exact expected date of a delivery, heartbeats have come up or not. Second sonography could be the nuchal thickness sonography to rule out the early fetal anomalies. Congenital anomalies scan by the end of 5 months is required. Interval growth sonography around 30 weeks, and when we come to the end of the third trimester, we might need a sonography for a color Doppler or a biophysical profile to know the fetal well-being and plan the delivery accordingly. Like we are dealing with a malpresentation or a placenta previa, we have to deal with it accordingly. So sonographies are compulsory during the management of the pregnancy.
Okay. So, from which month a female can experience fetal movements?
It's a beautiful experience to feel a baby moving inside you. I remember my time. Primary patient might take the lady who is pregnant for the first time might take her 20 weeks to experience that movement. Multi-patient who has already experienced it during her previous pregnancies, even 4.5 to 19 weeks she can start experiencing.
So coming to the diet part, as you know, the females are very cautious about the diet they take during pregnancy. I would like to ask whether we can take non-veg diet, and there is a myth about papaya, that papaya acts as an abortive agent. So can we have that during pregnancy?
Papaya, unripe and semi-ripe papaya and papaya seeds have to be avoided completely during pregnancy. It might generate the contractions in the uterus. Ripe papaya in a small portion is a good nutrient source. Your second question was about the non-veg. I feel non-veg is a very good source of a protein. If it's a well-cleaned, home-cooked, well-cooked non-veg, taking care of the spices and the oil we use in the recipe, it's a good source of a protein.
Okay, so now here we are clear with the diet part. Moving to the next question, we'll discuss about the physiological changes, like a female might have pedal edema and common language like swelling of the feet.
Yes.
How to deal with that?
To some extent, edema could be physiological because the gravity uterus is pressing on the inferior vena cava to some extent. But at the same time, we need to be cautious about, is it because of the anemia, is it because of some renal issues, or the hypertension coming up, or she is low on proteins. So a clinical team will keep a close watch on it. As a care, what she can do is have a leg elevation, reduce her salt intake, do the physical activity so that edema reduces.
Okay. So in parallel goes the issue of leg cramps.
Yes.
How to deal with that?
I know. Leg cramps is pretty common. Preconception fitness plays a role in such aches and pains and cramps. If a girl is fit right from the beginning, she might experience less of it. If she is having a leg cramps, better to go for a massage, leg elevation, physical exercises. She can go high on a protein diet, high potassium diet like bananas, coconut water. Vitamin E supplementation will really help. And if there is a pain along with the cramp, then the pain relievers can be recommended.
Okay. So here we have addressed most of the physical and physiological changes and the complications. Now moving on to the mental health. How to deal with the anxiety during pregnancy?
I know. It is a less understood but a genuine issue. All of us face anxiety. When we prepare for a 12th standard exam, 10th standard board exam, the entire family is involved and we prepare for a whole year. Here for a pregnancy, does a lady really prepare herself, or the family does prepare themselves? So pre-conception counseling, pre-marriage counseling does play a lot of role in dealing with the anxiety. Now the lady is pregnant, it's a third trimester and she is anxious about it. So the only thing she can do is stay calm, talk to her partner, talk to the family. She can always talk to her doctor. What is causing her anxiety? She can go for a deep breathing exercises, yoga, relaxing. If there is a fear, we need to explain her and take out that fear. And let her enjoy, relax, pamper herself and just go for it. It's nature. Nature will take care of it.
Okay. That was very nicely answered by you. So now, last but not the least, I would like to know what are the complications and the challenges that commonly a female encounters during pregnancy.
I know. Even though pregnancy is a natural and a normal phenomenon, a pregnant lady may come across certain challenges during each trimester. Now, when I'm coming to the first trimester, a lady might experience a bleeding by vagina. Maybe dual marker test has come abnormal, some chromosomal anomalies, or there could be a miscarriage during the first trimester. Second trimester, maybe we are dealing with a low-lying placenta, chromosomal anomalies, congenital anomaly, or even a second trimester abortion. During third trimester, commonly seen is a preterm labor, intrauterine growth retardation, 𝗾𝗂𝗏𝗀𝗀 getting less, 𝗾𝗂𝗏𝗀𝗀𝗀 getting more, or the malpresentation of the fetus, chorea on the neck, big baby. There is nothing to fear about it. Let's not be fearful, let's be careful. Even if such challenges occur, we can pick them up, analyze, discuss with the family and come to the best treatment option.
Okay. Well,
Ma'am, we have an audience here who has commented in the inbox that swelling over feet during pregnancy, is it okay?
To some extent, it could be physiological, but we need to be careful. Are you facing an anemia? Are you having a hypertension? Or are you likely to develop a hypertension in coming few weeks?
okay. Any more questions that we have? Okay. So thank you so much, ma'am, Dr. Jasmine, ma'am. This session has been really informative.
Thank you.
You have very beautifully addressed to the topic of various phases of pregnancy and the trimesters during it. So, lastly, I would like to add on that pregnancy has never been a cakewalk. There are various challenges and complications that a female goes through during the pregnancy, but with moral support of the family and an expert team of clinicians, we can deal with it. So here at Queens, we do have an expert team of clinicians, gynecologists and staff to help you throughout the your phases of pregnancies. Thank you so much and thank you for your time.
Yeah, thank you.